Hi, everybody. Derek Sloan here. I'm here again with Dr. Patrick Phillips. You remember that Dr. Phillips is under attack from the College of Physicians and Surgeons of Ontario. There was an important hearing that he was a part of just a few days ago with some other doctors as well. One of the major things that Dr. Phillips did, his sins, so to speak, were to submit vaccine adverse event reports. He prescribed ivermectin and fluvoxamine to patients for COVID treatment, and he also gave some vaccine exemptions. And for that, his license was pulled, and he's been unable to practice medicine for many months now. Um, we spoke last time about your particular situation, and I just want to dig into that a little bit more and get into a conversation about sort of medical freedom generally, because a lot of people don't understand that things really shifted in COVID-19. Doctors had a lot of latitude before to sort of practice medicine according to what they thought was in the best interest of the patient, according to their own understanding of things. And you ran into a bit of a brick wall on that issue. Specifically, I want to let people know about these vaccine adverse event reports here in Canada. Um, Most people think, most people, maybe people who disagree with our opinion on being skeptical of COVID measures, they'll say, well, Derek, if you look at the adverse events from the vaccines, there's not that many of them. It's very few, low percentage. So you guys are really, exaggerating this claim. But most people don't understand that when you as a doctor submit an adverse event report, it doesn't just go into the system. There's a nebulous group of overseers that decide whether those reports get submitted or not. So tell me about what happened in your case.
Yeah. So again, thank you for having me on. Around the end of March, beginning of April is when we had our vaccine rollout in 2021 in Englehart, Northern Ontario. And it was around that time that I started to see some very concerning adverse events. And when I see things coming into the hospital, especially when there's a novel agent coming around, when somebody has new symptoms, and according to actually Health Canada, if there's new symptoms or an exacerbation of worsening symptoms after one of these agents come in, that's considered an adverse event. So according to Health Canada, when I saw patients who came in with new symptoms, often within days or weeks of the vaccine, I submitted an adverse event, and that's actually required by law. So I saw people with devastating injuries. Many people had to be hospitalized, severe fevers, delirium, worsening dementia, nerve injuries in their arms that prevented people from being able to work because they were dropping things because they weren't able to use that arm. That's not a normal soreness that you would get after a vaccine in the shoulder. Um, uh, that's many of the things that I saw. So I started sending these off to my local public health officer.
And Patrick,
And
if I can just
yeah,
cut in quickly, it seems to me that you live in a town where you actually know people. This isn't like downtown Toronto where every person that comes into the emergency room is brand new. You kind of have a sense of who people are and what their history is. Is that correct?
somewhat true. I mean, I'm new to this town. I worked in Englehart for about 2 to 3 years, on and off as a locum, and then I just moved up here in December of 2020. Um, so that's when I actually came around. So I knew the regulars for sure, and I was getting to know the community. In general, you would if you've been here for more than that. But yeah, I was getting to know people. I wouldn't say that I knew everybody coming in, but um, but yeah, it's a small town, and it's very telling too, because in a town of 1,500 people, um, to start to see even 5 or 6 adverse events coming in, that's pretty huge when you extrapolate that, like what must be happening in the cities, right? And it was definitely very concerning. So I sent that off to the local public health officer, thinking there's going to be an investigation. They'll probably want patient charts or whatever to like review to see what happened, because I'm just working in the emerge department. I don't necessarily know everything that happens after, right? Did it solve or did it not? I don't often know. I can't follow up with them. So anyway, I send that off to the public health officer. Then about within about a month, I got a letter from the public health officer. No phone call, no courtesy conversation at all, but basically said all five at that time of my adverse event reports were rejected. They did not meet their strict criteria, which are very arbitrary. I'll give you one example of that criteria. If you pass out after the vaccine, not an adverse event. But if you pass out and hit your head and get a head injury, that is an adverse event, but only if it's within 30 minutes. If you pass out 31 minutes after the vaccine and get a head injury and even die or pass away from that, it's not an adverse event because it wasn't within that 30 minutes. And there's other very arbitrary criteria for other things as well. But they're very specific about these, and they're not open to anything that's not expected, right? So there's only like fainting, sore arm. I mean, there's a whole list of them, but it's very specific and they don't include many other things. So anyway, they rejected all of my reports, which I was very concerned about because we have a novel mRNA genetic injection we're injecting into people, and the public aren't even able to get a database of adverse events. All of them are getting rejected. So I sent I faxed a letter back to him. I wrote on his note and said, why are these being rejected? Please send them back to me. If there's deficiencies or whatever, I'll fill them back out because they shouldn't just be rejected for no reason. And he did not respond to that, but instead sent a letter to the CPSO reporting me for all my adverse events. And the CPSO came in, has investigated all of them, did interviews with the patients and everything, most of whom agreed that it was an adverse event. Some didn't, but it doesn't really matter. Like the criteria is new symptoms or worsening symptoms after the vaccine. Because you can't necessarily know whether it was caused or not. That's not a thing. Like you just have to take the aggregate and see did it get worse after the vaccine. Anyway, the CPSO has now charged me with professional misconduct for every single one of my adverse event reports, all of them. So I get it. If I was,
how many were there?
faking it, what's that?
How many were there?
9. I have to admit, and this is maybe breaking the law in some way, but after that happened, especially after the CPSO started coming after me, I stopped reporting the adverse events. And I think that's what most doctors have done. Mm-hmm. So I've seen more devastating things that were even worse than I reported, and then just stopped reporting them. And I did that for 2 reasons. One is I was getting in trouble for it, but that wasn't the only thing. What concerned me even more is when I reported these adverse events, they told me in that letter that they call them up, tell them it's not an adverse event, and tell them they need to get their booster. And so that, in my opinion, is malpractice. And so every adverse event that I reported, I actually put that patient at higher risk of getting coerced into a booster that could have caused some very serious health problems for them. So not necessarily that it would, but it definitely, if somebody had a seizure or whatever after a vaccine, no doctor in their right mind previously to COVID would ever say, get another one of those. Like that's insane. You have to weigh the costs, the harms, and the benefits. So I stopped reporting those, and I saw hemorrhagic strokes in people who are perfectly healthy, I saw heart attacks, massive heart attacks within weeks of getting the vaccine, people who didn't previously have known heart disease, within like days to weeks, like not insignificant in my mind. But I felt compelled to not do that both for my patients and for because it was backfiring, right? They retaliate when you report those adverse events. And I'm not the only one, right? So many people that I've talked to have tried to go into an emergency department or tried to go see their doctor and ask them to report this in their symptoms in an adverse event, and they refuse to. And I understand now why, because you are actually at risk of losing your license for reporting adverse events.
It's a wonder any of these adverse events actually get reported. It seems like you have to have literally something happen while the needle's in your arm for it to be considered an adverse event. And that's, it's really troubling and striking. that sort of control is going on here in Canada.
Yeah. No, it's true. It's very concerning. Yeah.
It's funny. There's always things that circulate on the internet, and I happened to see this montage of an X-Files episode from about 5 years ago. Have you seen this before?
No, no.
So the theme of this show is that some nebulous government conspiracy, along with big corporations and big pharma and whatever, have concocted this scheme to, and it's straight out of the conspiracy annals of the internet. But they've concocted a scheme to give everybody a smallpox vaccine that would change their DNA, shut down their immune system, and depopulate the earth. And this is an episode from 2016 or something. I just saw this yesterday, and
Yeah.
it's bizarre how. And they even had this play in the episode. A lot of people didn't want to believe it because it was just straight conspiracy from the internet or whatever.
Yeah.
But I got a real kick out of that episode, and it's bizarre how similar that seems to be in many ways to what we're seeing today in terms of government control, and everything's being called a conspiracy, and a vaccine that's being implemented that has a lot more adverse effects than anybody's letting on. So it's
Yeah.
shocking to see what we're seeing. So thank you so much for being with us here today.
Thank you for having me on. I really appreciate it.
Okay, we'll talk to you soon. Thanks a lot, Patrick.
Thanks.